join me in extending a warm welcome to Dr. DiMuro, a national expert in the field of pain management and founder of DiMuro Pain Management. He is double board certified in pain management and anesthesiology. Dr. DiMuro served as the former chief medical officer for the state of Nevada. Dr. DiMuro's accomplishments include the creation of Assembly Bill 474, also known as the opioid law, which passed unanimously. He graduated cum laude with a master's degree in business administration from St. Joseph's University in Philadelphia, with a major in healthcare administration. Dr. DiMuro has played significant roles as a board member, proctor, senior faculty for prestigious organizations such as Boston Pacific, Avanos Health, and NIA Magellan. We genuinely appreciate Dr. DiMuro for taking the time out of his demanding schedule to engage in a fireside chat with the GVHS Medical Society.
Well, thank you for having me.
Yeah, of course. So we'll get started with question number one. As a highly successful pain management physician, what advice do you have for our members who aspire to excel in the medical field, particularly in the area of pain management?
I think it's very important to really find out if you want to go into the field of medicine. I was very inadequately prepared when I had applied to medical school, as I didn't truly understand the demands it has on your life, both personally and professionally. So the best advice I would have is to make sure that you've done research on what exactly it takes to become a medical professional, whether it's a doctor or a nurse practitioner or a physician assistant or a nurse, and see if you really do enjoy the demands of the lifestyle and taking care of patients. And it's not just a matter of taking care of patients and their illnesses. There's a whole list of things that go into it. I had one patient just today in the operating room where she didn't have her ride home was not available. So we had to hold on for her for hours, and we had to decide what we were going to do with her and how we were going to discharge her from the facility. So there are little logistical issues that are also involved. But the best thing that you can do is to try to shadow a medical professional. If you think about going into a surgical subspecialty like anesthesiology or surgery, try to spend a couple of hours with a physician, go into an operating room. And most physicians are very approachable. We all remember what it was like when we were starting out. So the bottom line is gain as much experience as you can in whatever way you can to try to see if this is truly what you're called to do.
Wow, that is really good advice. And I really resonate with that because I was actually told before that a lot of doctors will think that they know what they want to be with their career. They go through college or medical school, and then by the end of it, they have a completely different medical field career choice. So I think that's definitely a good idea, is to see the life of what these people who live this career that you want to have, what it's really like, which is why I think this club is so cool, because we have multiple different doctors from different medical fields. So everyone gets to see like a day in the life of the future career that they want.
I agree.
Awesome. So then we'll get started with question number two.
Hi, I'm Jamie. I'm the vice president. Could you please describe what a typical day looks like in your pain management MD? Additionally, what are some main responsibilities and challenges that occur on a daily basis?
Well, I just told you one that happened today. They can be as simple as caring for a patient who comes in with an illness versus having to worry about logistical constraints after an operative procedure. So a typical day for me is I'll split my day up into half the day in the operating room, where I'll perform procedures from about 6 a.m. till about 1 o'clock or 2 o'clock. Most doctors don't take a lunch. We just kind of work straight through. And then in the afternoon, as we are now here after 5 o'clock, I'm just finishing up my afternoon clinic. And clinic is when you see patients in the office. So if you were to get sick and go to the doctor's office, you would be seen in their office setting. So when you're in the examination room, that's when the doctor's performing their clinical time. So half day for me in the operating room, half a day for me in the clinic. And then now I would be making phone calls to patients and cleaning up paperwork and filling out forms and doing a whole list of things that my office has decided to give me for the day. So it is, the day in medicine is not 9 to 5. This is not shift work. You really need to know what you'd like to do and if you're willing to do it. It's why many physicians are going into part-time. They may not have realized the demands of whether it's parenthood or some of the demands of their subspecialty. It's very difficult to get into a subspecialty like surgery or like I am, anesthesia. And when you're taking call, I'm in my mid 50s. And when you're taking call, it's an all night thing. You'll be in the hospital all night and you have to work the next day. So the constraints, especially if you're a parent and you have young children at home, these are things that you have to think about. You have to think about whether or not childcare. You have to think about your weekends. If you enjoy having weekends to yourself, being in a surgical subspecialty is definitely not for you. So again, rounding with doctors or spending time with doctors, especially in the subspecialty that you would want before you go into medical school, is going to be so important. You don't want to be in medical school and then realize, oh my God, did I really do the wrong thing? Maybe I should have been a nurse or a physician assistant or a nurse practitioner. So really think it through. I did not, and I did not realize the demands that it really took. So please, please, please make sure you do all the research you can so you truly find out if this is what you want to do.
I completely agree. It's really time consuming and demanding, and I feel like you're doing an amazing job being able to be on call with us and take care of patients. Like, I applaud to you.
Thank you.
Hi, I'm Basil. I'm the secretary.
Hi.
We're interested to hear about your journey from clinical practice to serving as the former chief medical officer for the state of Nevada. What inspired you to make this transition, and how has this experience shaped your perspective on pain management and anesthesiology?
Well, first, I never applied for the position. I was actually approached by a state legislator to see if I would even be interested in it. Governor Sandoval at that time had an interest in trying to craft an opioid bill for the legislature. And as you probably know, there is an opioid epidemic and abuse of drugs such as fentanyl. You may have heard of fentanyl. Fentanyl is a very powerful opioid. We use it every day in the operating room. It is a very, very reliable anesthetic that we use on any patient that you know that's had surgery. 99.9% chance that they've had fentanyl. And so it's everywhere, it's ubiquitous, and we use it all the time. It's quite reliable. So when I was asked to consider for the job, it was going to be a big change for me from being in private practice. Government typically does not run very well, and we could spend hours and hours, and I could tell you about the intricacies of government. So making the change from private practice to dealing with the government was very difficult, but I wanted to try to make a difference in this state. And I think we did. I actually crafted an opioid bill that is currently the standard. I was actually invited to the White House to actually present our version of the bill. So what we have here in Nevada is a very reliable means for doctors to be able to prescribe opioids safely and effectively. So I enjoyed it. I took care of things such as epidemics and infectious disease outbreak. I was not there during the COVID crisis, although I was the chairman of the COVID committee in Washoe County up in Reno. I also dealt with the Mandalay Bay shooting and the fallout from that. So every day was very different, as opposed to being in medical practice, which every day is basically the same. You're a specialist and you're seeing patients who are having the same presentation. If you're a pediatrician, you're seeing a lot of children with ear infections. If you're a spine surgeon, you're seeing patients with bad spines. So it really was a break from the monotony of day to day. I enjoyed the changes and the variations in my daily schedule and dealing with people on all different levels. Making decisions for one patient at a time in private practice is a lot different than making decisions for 2 to 3 million people on a daily basis. So it's a big change for me. I enjoyed my time with the state for sure.
I think that's amazing how much like influence you had over all this like medical like all these medical things, and that you were able to like control, or like not control, but like, you know, like have a say in what happens, and also like having that shift in um like your day-to-day stuff into all this huge stuff is like really cool.
Thank you.
Hi, I'm Liz. I'm the treasurer of the Medical Society. Um, I'd like to ask you, how do you stay updated on the latest developments and advancements in the field of pain management, and how do you incorporate them into your practice?
Excellent question. So there's typically two ways that doctors will keep up to date on innovations and changes in treatment guidelines and algorithms. And the classic way is we are able to attend continuing medical education courses. So every year we have to devote a week, so 40 hours a year. So it doesn't seem like much, but it's a full week. And as doctors, we don't take much vacation. So we have to dedicate 40 hours a year, and some societies in medicine differ, but it's about a week a year that you have to dedicate to continuing medical education. So at these continuing medical education or doctors meetings, you will meet with experts, and we will review different topics and decide on what are the appropriate changes and specific approaches to disease processes. The second way are journals or magazines that we read. So instead of just getting the education, going to, you know, I was going to say Las Vegas, but now that I live in Las Vegas, this was a very popular destination for doctors all over the world to attend. Usually the weather is quite reliable. So we would attend a course out in Las Vegas. But otherwise, we would read journals. So every specialty in medicine has its own journal or set of journals. There are different subspecialties within the subspecialty. So journals and continuing medical education pillars of how doctors maintain their knowledge on a go-forward basis.
Thank you for sharing that. That's really insightful to see how like doctors actually are able to keep up in the field, because it's not something that's typically shared. When you talk to different medical specialties, they won't often share how they keep up with what's going on in their field. So that's really insightful. Thank you.
You're welcome. And I'll just give you one other example. You're growing up at a time where so many surgeries are done robotics. You probably hear this all the time. You might even see it on the billboards. Well, when I was in training, which was about 30 years ago, these surgeries that are so routinely done through these little holes and these cameras that are the size of my iPhone camera right here, now we're able to do surgery through these little incisions. And you couldn't do that years ago. And unfortunately, the public thinks that these are, well, it's just a small surgery, because they judge the surgery by the size of the incision or the size of the scar, when really some of these surgeries are very complex. Taking out a gallbladder may only be 10 or 15 minutes, but there's a lot that can go wrong. But because it's a small scar, everybody thinks it's just such a basic procedure. They're not. So can you imagine being the doctor who trained before these little cameras were invented, and then having to go back and learn how to do them? So this is where doctors will attend weekend courses to learn new skills and innovations that come out. I had a professor when I was at Georgetown who told me that after 10 to 15 years of being out in practice, everything changes. There'll be all new changes in how to approach different disease processes. It could be a different antibiotic. It could be the development of robotic surgery or a new type of medicine that's used. So it changes all the time. You're going to be going into medicine at a really wonderful time with all these innovations and technological advancements.
Wow, that is really cool to think about. It's stuff that you don't really think about, but that is true, especially because we're still young. We still have so much time for so many more advancements to come out. So that's going to be really exciting to be learning about that in school, because that will be the new way to do certain things in medicine. So we'll get
Agreed.
started with our last question. Thank you. So, Dr. DiMuro, I've been following your practice on Instagram and have been impressed by the lively atmosphere, the evident diversity among your staff, and the positive vibes portrayed in your posts. Can you share some insights into how you cultivate such a supportive and vibrant work environment?
I'll thank you for that, and hopefully my employees feel the same. I think the majority of them do. It's one thing to start a business, and I don't know how many of you have started your own businesses or perhaps had family members who started their own business. And when you start a business, it's very easy when you're the president of the business, you're the CEO, and you're doing all of the work. It's a little different as you add more people on as you grow. And then once you grow, you're faced with a different set of problems. So what I've always done is I try to cultivate a watch how I do it first approach. I don't ever ask anybody who works for me to do something that I myself wouldn't do. If there's a toilet is clogged, I'll go and unclog it. If there's stuff on the floor, I'll clean it. So I think that performing tasks like that and showing everybody respect is probably the most important thing to me. And I think that my employees will see that. One of the things that I've done, and I think it's don't tell anybody about this, but one of the things that I like to do is I like to hire people without experience. So I like a resume with nothing on it. The minimal stuff that I love to see, I will tell you right now that the people that I love to hire are baristas. You give me a barista at Starbucks who can multitask and talk to people, I'll hire them in a heartbeat. So that's what I like to see. So if I don't have people with medical experience, which is the majority of the people I've hired, I always love to see if people work in fast food or Starbucks is great. So people who've worked at McDonald's, KFC, I always find it funny because most of the high school students that I speak to, they're kind of embarrassed to tell me that they work in those industries. And I have found success with people who have been successful working there. If you're willing to mop a floor, you can deal with patrons, collect money, make change, think on the fly. Those are the people I want. So I've been very fortunate in finding those people. I'm a little picky when it comes to who I want to work for me. I will tell you that biggest piece of advice I would give you is when you make your resume, nothing irritates an employer more than if you don't look at your own resume and find spelling mistakes. If you're not going to look at your own work and proofread it, what do I think you're going to do when you're going to do for me? Another piece of advice, have a professional email. Use your name and maybe a combination of your favorite numbers or birthday at a good internet provider like Gmail. Nothing is a red flag worse than seeing someone who has an email that's a secret. It doesn't have any components of your name. I have to worry about, maybe some inside joke that you may have when you made that email. It's not professional. So having a professional email, having a professional resume with no mistakes or a minimal number of mistakes really means a lot when you're coming into meet employers. If you're going to go work with a surgeon or go into a hospital, make sure that you have a copy of a resume. It may only say that you've worked at Starbucks and you are attending high school at Green Valley High School. That's great, but it shows me that you put 5 minutes of time in to create a document with an appropriate typeface and font. It's aligned appropriately, and you have it in an envelope ready to give to anyone who wants it. All of you, if there's one thing you should do this weekend, you should get a resume together, and you should have it ready by Monday morning. And every week when you do something, whether it's even you put this lecture together and who you interviewed, you put that on the resume. And not enough, you have all this access to technology, and I'm just not seeing enough people coming in prepared. But there's no bigger red flag than someone who can't give you the courtesy of a respectful resume and write a cover letter. So that's a big piece of advice. I'll give you one more piece of advice. And we had talked about this last time, which is the ability to take constructive criticism cannot be overemphasized. There's nothing worse than when you try to make someone better. If I take time out of my schedule to tell you that your resume needs some work, or to tell you that maybe, your penmanship should be better, or you should be able to take better notes, or you should be nicer to the patient. Nothing is a bigger red flag than if you just brush that off and you don't make those changes. It's not going to help you on a go forward basis. And it definitely tells me that you're not interested in being here. Maybe you want an hourly wage, but I definitely don't see that as you desire growth and to try to make my organization better. You're a reflection of who you work for until you do it yourself. And for the company to be strong, it allows you to grow as well. Young people forget that. You think you might walk into my office and think, oh my gosh, he's so successful and it was just handed to me. But you don't realize when you come into my office that I started this office with a dirt floor and I went millions of dollars into debt. And I had to rely on the employees to work with me and show that work ethic to move forward so everyone can benefit. So just the ability to take constructive criticism and always try to better yourself. Once you think you know everything, trust me, you don't.
Wow, that is truly inspiring and really great advice. I really resonate with how you also said about who you hire. I kind of do something similar in a way with my club. I try to keep a fun and uplifting environment. So I'll sometimes have nothing but cakes or canes at our meetings so we could snack on it during our meeting. And yeah, I think it's also a really great advice about making a resume. I've made a resume before because I used to actually be a lifeguard at the Mandalay Bay. So it's definitely having a resume. You never know what you could use it for. But if there ever becomes a situation, you're going to be like, I'm so happy I have this on me. It's ready to go. You never know how it can help you. And all it takes is a little bit of time to just draft up quick resume, all your things you did, things you're interested in, what you want. And yeah, it's really great advice and I appreciate it.
You're
I was
welcome.
also wondering if you could also go over that one quote you said on the last meeting I had with you that just really stuck with me about how you have to show up and keep showing up. I think that'll be a really great addition to our meeting for our viewers to hear next
Yep.
Tuesday.
So I always tell people 90% of life is just showing up. And it's something that resonated with me when I was young. It is still amazing to me how many people can't show up on time or they want to leave early. But if you're showing up and you're putting the time in, good things will happen, I assure you. Always know what you want to do, at least for the time being. If you want to work at Starbucks and be a barista, that's great. If you want to use it to move ahead in management, I know two individuals who worked at McDonald's and now they own McDonald's and several. And they started out cleaning floors and starting at the bottom. No one's going to hand you anything. If it's handed to you, maybe it's because that person either knew somebody or perhaps a relative had started that business or made that money separately. You're going to have to put the time in. I would rather the person who worked for it come work with me and I can take them to the next level rather than the person who was handed to. So nothing's more irritating than when you want to start and you don't want to start from the bottom and you think all of a sudden you're going to start in the middle or at the top. And having a college degree doesn't guarantee success either. Showing up and having a desire to make your organization better is what's going to get you ahead and provide you with future opportunities.
Wow, thank you so much. Such powerful words. I really appreciate for you being able to make this meeting. It is just a huge thank you from me and our members and our board members. It means truly a lot. And thank you for being able to make this meeting. It
You're
was
very
really nice to hear your words of wisdom once again. I think this is probably one of our most powerful meetings that our members are going to get to hear. So that's just really cool.
Well, you're very welcome. Thank you for contacting me. And if you ever need anything in the future, please don't hesitate.
For sure. Thank you so much. Have a great night and a good weekend. And I really appreciate it. Awesome.
You all as well. Thank
you.
you. Bye-bye.
Bye.